If your legs or feet are swollen when you go to bed tonight, this could be quietly putting stress on your heart, your circulation, and your ability to stay independent. And many seniors are never told what to do about it at night. Some people wake up with ankles so tight they cannot bend them. Some struggle to put on socks or shoes in the morning. Some feel heaviness, aching, or throbbing by the end of the day. Many believe this is just part of aging, something you have to live with. That belief is wrong. For many seniors, swollen legs happen because fluid builds up all day and never gets a chance to drain properly. Gravity pulls fluid downward while you sit, stand, or walk. By evening, that fluid settles in the feet and lower legs. Some feel heaviness, aching, or throbbing by the end of the day. Many believe this is just part of aging, something you have to live with. That belief is wrong. For many seniors, swollen legs happen because fluid builds up all day and never gets a chance to drain properly. Gravity pulls fluid downward while you sit, stand, or walk. By evening, that fluid settles in the feet and lower legs. They are based on simple science. Your body already understands. According to the National Institute on Aging, leg swelling becomes more common as we get older because circulation slows and daily movement often decreases. This means fluid is more likely to collect in the lower body. According to the Mayo Clinic, gravity causes fluid to pool in the legs during the day, especially in older adults or people who sit for long periods, sleeping in a chair with your feet down, lying flat without leg support when veins are weak, eating salty foods late at night, drinking too little water because you fear swelling. These habits quietly keep fluid stuck in your legs. That is why this video focuses on bedtime routines, not daytime workouts, not medications. You will learn 5 simple routines. Each one supports natural circulation. Each one takes only a few minutes. Together, they can make a real difference over time. Before we begin, one important reminder. Swollen legs can sometimes signal serious health problems, including heart issues, kidney problems, or circulation disorders. Later in this video, we will talk about warning signs and safety. These routines support healthy circulation. They do not replace medical care. Now let us talk briefly about what is happening inside swollen legs. Your heart pumps blood down into your legs. But getting blood and fluid back up is harder. Veins rely on muscle movement to push fluid upward. When muscles squeeze, veins are compressed. This helps blood move toward the heart. As we age, muscle movement often decreases. Vein valves may weaken. The lymph system slows. According to Medline Plus, the lymph system helps remove excess fluid from tissues, but it depends on movement and positioning. When these systems slow down, fluid collects. The good news is this: your body still knows how to move fluid. It just needs the right support, and that support can begin today. In the next part, you will learn the first bedtime routine. This routine prepares your legs for drainage before you even fall asleep. This is where real change begins. Before you fall asleep, how your legs are positioned can decide whether fluid drains out or stays trapped all night. Many seniors believe lying flat is best. For swollen legs, that is often not true. According to the Mayo Clinic, fluid builds up in the legs during the day because gravity pulls it downward. At night, if the legs are not supported, that fluid has no reason to move back up. The goal of this routine is simple. Use gravity to help your body, not fight it. When your legs are slightly higher than your heart, fluid has an easier path to travel upward. Blood moves back toward the heart. The lymph system can remove extra fluid from the tissues. You do not need to lift your legs high. Gentle elevation works best. Too much elevation can strain the lower back or knees. Discomfort can interrupt sleep, and poor sleep slows healing. Here is how to do this safely. Lie on your back in bed. Place 1 or 2 firm pillows under your calves, not directly under your knees. Your heels should be supported. Your knees should stay slightly bent. Your legs should feel relaxed. If your lower back feels uncomfortable, reduce the height. Comfort matters. According to the Cleveland Clinic, even mild leg elevation helps veins return blood more easily to the heart. Now, let us talk about common mistakes. Do not sleep in a recliner with your feet down. This allows fluid to pool all night. Do not place pillows only under your feet. This bends the knees backward and can block circulation. Support the entire lower leg. Now let us talk about timing. This routine works best when you start before swelling becomes severe. Set up your pillows when you first lie down. Your body responds best to gentle drainage over many hours. What should you expect? Do not expect swelling to disappear in one night. That is not realistic. What many seniors notice first is less tightness in the morning. Socks leave fewer marks. Shoes feel easier to put on. These are signs fluid is moving. According to Medline Plus, consistent leg elevation helps reduce daily fluid buildup over time. Consistency matters more than height. If you have arthritis or joint pain, adjust slowly. One pillow is enough. Even a folded blanket can help. Never force your legs into a position that causes pain, numbness, or tingling. That is your body asking you to stop. One important safety note: if one leg becomes much more swollen than the other, or if swelling appears suddenly with redness, warmth, or pain, seek medical care. Do not try to fix this at home. Now that your legs are positioned to allow drainage, we move to the second bedtime routine. This one uses gentle movement to help push fluid upward. It can be done right in bed. With your legs supported, your body is ready for gentle movement. This is not exercise. It is simple motion. Many seniors avoid moving their legs at night because they fear cramps or pain, but the right movements often reduce discomfort. According to the National Institute on Aging, leg muscles act like pumps. When they contract and relax, they help push blood and fluid upward through the veins. Even small movements help. This routine takes about 3 to 5 minutes. It can be done while lying in bed. Lie on your back with your legs supported on pillows. First movement: slow ankle pumps. Point your toes away from you. Then slowly pull your toes back towards you. Move only as far as comfortable. Do not force the motion. Do this 10 times. This movement gently squeezes the calf muscles. According to the Cleveland Clinic, the calf muscles play a major role in moving blood back toward the heart. Second movement: ankle circles. Rotate one ankle slowly in a circle. 5 circles in one direction. Then 5 in the other direction. Switch legs. This helps fluid move through the small vessels around the ankles and feet, where swelling often begins. Third movement: heel slides. Keep your heel resting on the bed. Slowly slide your foot toward your body. Then, slide it back down. Do this 5 times on each leg. This activates the thigh muscles without strain. Now let us talk about breathing. Breathing helps circulation more than most people realize. According to Harvard Health, slow, deep breathing helps fluid move by changing pressure inside the chest. This pressure helps pull blood and fluid upward. While doing these movements, breathe slowly. Inhale through your nose. Let your belly rise. Exhale through your mouth. Do not hold your breath. This routine should feel calming, not tiring. If you feel pain, sharp discomfort, or cramping, stop. Many seniors notice warmth or tingling during this routine. That is a sign circulation is improving. What should you expect over time? Less nighttime throbbing. Less heaviness in the legs. Less stiffness in the morning. Many seniors notice these changes within 1 to 2 weeks. Now let us talk about what not to do. Do not kick quickly. Do not force stretching. Do not add weights. This is not about strength. It is about flow. If you have nerve problems or reduced sensation, move slowly and pay attention to how your legs feel. This routine prepares your body for the next step. The next routine surprises many people. It involves water, but not the way you might think. This next routine often feels confusing at first, but it is very important. Many seniors with swollen legs stop drinking water in the evening. They believe less water means less swelling. For many people, the opposite happens. According to Harvard Health, when the body is even slightly dehydrated, it tries to hold on to fluid. This can make swelling worse. Your body is protective. If it thinks water is scarce, it saves it. That extra fluid often settles in the legs. The goal is not to avoid water. The goal is to drink it wisely. Here is the simple approach. Drink most of your fluids earlier in the evening. Then slowly reduce intake about 2 hours before bed. Small sips work better than large glasses. According to the Mayo Clinic, steady hydration helps the kidneys remove excess sodium. Sodium is a major cause of fluid retention. Now, let us talk about salt. Salt pulls water into tissues. This includes the legs. Many seniors eat salty foods at night without realizing it. Canned soups, processed meats, crackers, cheese, frozen meals. According to the American Heart Association, higher sodium intake leads to more fluid retention, especially in older adults. If leg swelling is a problem, avoid salty snacks in the evening. Choose simple options instead. Fresh fruit, unsalted nuts in small amounts, plain yogurt. Here is a helpful habit. About 90 minutes before bed, drink a small glass of water. Not large, just enough to feel comfortable. This signals to your body that water is available. It reduces the urge to hold on to fluid. If you take water pills or heart medications, follow your doctor's guidance. This routine supports healthy habits but does not replace medical advice. Another important point. Alcohol can worsen swelling. According to Medline Plus, alcohol causes dehydration first and fluid retention later. This can increase leg swelling overnight. If swelling is a concern, avoid alcohol in the evening. What should you expect when hydration is balanced? Less tight skin by morning. Less indentation when you press your ankle. More comfort overnight. Now let us address a common worry. Waking up at night to use the bathroom. This is why timing matters. Hydrate earlier. Reduce intake closer to bedtime. Most seniors find a balance within a few nights. This routine works quietly. You may not feel it happening, but your body responds. Now your legs are supported. Your muscles have helped move fluid. Your body is not holding water out of fear. The next routine uses warmth and gentle touch to help fluid move even more easily. This routine is calming and often feels very comforting. It focuses on warmth and gentle touch. Many seniors focus only on blood flow, but the lymph system also plays a major role in swelling. According to the Cleveland Clinic, warmth helps blood vessels relax. When vessels relax, fluid can move more freely. Cold causes vessels to tighten. Tight vessels can trap fluid. That is why cold feet often swell more. Here is how to use warmth safely before bed. About 1 hour before sleep, take a warm shower or a warm foot soak. The water should feel comfortable, not hot. Soak your feet and lower legs for 10 to 15 minutes. This helps open small blood vessels near the skin. It prepares your legs for drainage once you lie down. After drying off, use gentle touch. This is not deep massage. According to Johns Hopkins Medicine, light skin stimulation helps lymph fluid move. The lymph system sits close to the skin and responds to gentle pressure. Here is how to do it. Sit or lie comfortably. Use clean hands. You may use a small amount of lotion if you like. Start at your feet. Use light, slow strokes, moving upward toward your knees. Always move toward the heart. Use about 5 strokes per area. Move slowly. Do not press hard. Strong pressure can collapse lymph vessels instead of helping them. This should feel soothing, not painful. Spend about 5 minutes on each leg. Important safety note: if you have fragile skin, open sores, infections, or recent surgery on your legs, skip this step. If you have a history of blood clots, talk to your doctor before using massage. Now let us talk about socks and clothing. Tight socks or tight elastic bands around the ankles can block circulation. According to the National Institute on Aging, tight clothing can worsen swelling by restricting blood flow. Before bed, remove tight socks or anything that leaves deep marks on your skin. If you wear compression socks during the day, remove them at night unless your doctor has told you otherwise. At night, your body needs freedom to drain fluid. Loose socks are fine if your feet feel cold. This routine works best when combined with the earlier routines. Warmth opens the vessels. Gentle touch guides fluid upward. Elevation and movement do the rest. Now there is one final routine. This one works while you sleep. It helps prevent fluid from settling back into your legs overnight. We will also review safety, warning signs, and an important reminder before the end. This final routine works quietly while you sleep. It brings everything together. Even with good leg support, movement, hydration, and warmth, sleep habits still matter. According to Harvard Health, breathing patterns during sleep affect circulation and fluid movement. Slow, steady breathing helps blood return to the heart. Shallow breathing does not. Here is what helps most seniors. If you can, sleep on your back. This allows even drainage from both legs. If you sleep on your side, place a pillow between your knees. This keeps the hips aligned and prevents pressure that can block blood flow. Avoid curling tightly into a ball. This compresses vessels in the hips and thighs. Now, let us talk about breathing. Before you fall asleep, take 5 slow breaths. Inhale slowly through your nose. Let your belly rise. Exhale slowly through your mouth. Let your body relax. According to Johns Hopkins Medicine, deep belly breathing helps blood and fluid return to the heart by changing pressure inside the chest. If you wake up during the night, take a few slow breaths again. This supports circulation and helps you relax back into sleep. Now, let us talk about warning signs. Swelling is common in older adults, but not all swelling is normal. According to the Mayo Clinic, seek medical care if swelling is sudden, painful, red, warm, or mostly on one side. Also, seek help if swelling comes with shortness of breath, chest pain, or sudden weight gain. These can be signs of serious medical problems. Now, the disclaimer. This information is for education only. It does not diagnose or treat disease. It does not replace medical advice. Always speak with your healthcare provider before changing routines, especially if you have heart disease, kidney disease, diabetes, or circulation problems. Now, let us review what you learned. You learned how gentle leg elevation helps gravity move fluid. You learned how small movements activate muscle pumps. You learned why smart hydration reduces fluid retention. You learned how warmth and gentle touch support lymph flow. You learned how sleep position and breathing help circulation overnight. These routines are simple. They are gentle. They work best when done consistently. Many seniors notice improvements within 1 to 2 weeks. Now the call to action. If this video helped you, share it with someone who struggles with swollen legs. Subscribe to Prime Health Daily for clear, simple, science-based health guidance for seniors. Leave a comment and tell us which routine you plan to try tonight. Your experience can help someone else feel less alone. And remember this: swollen legs are common, but they are not something you must accept without support. Your body still knows how to move fluid. You just need to help it do what it was designed to do. You can start tonight.